Hi, everybody. My name is Julian. My pronouns are they, them. I am a community health worker with the vaccine outreach program through UPAC. And today we wanted to talk a little bit about mental health and coping strategies. Obviously, it goes without saying that it's been a very overwhelming, difficult, anxiety-inducing, stressful.
Yes.
Well, how long has it been now, Kenji? I don't even know, like 2 years?
2 years,
Almost
yeah.
2 years. And Kenji and I here, having a background in mental health, wanted to give y'all some strategies and quick coping mechanisms that are accessible, that have worked for us, and we are hoping that they work for you as well. Kenji, did you want to talk a little bit about yourself?
Absolutely, yes. My name is Kenji, and I'm a peer support specialist by trade, working with the VOP program to help inform the public about vaccines, testing, and the booster shot. For me personally, I believe COVID has affected me a lot because my coping skills I usually have weren't working as much as they should. And I had to find new coping skills during the last couple of years.
Yeah, it certainly, has taken a toll on all of us for sure. And it actually, I know, like, in my experience with having a therapist, I know that all the therapists got booked. Like, mental health has been just an area of everybody's life that has recently required so much more attention than what we had been giving it before.
Yes.
It just kind of like became very important to start talking about mental health. I mean, it was important before, but I feel like with the pandemic and so many stressors, it just became even more important.
Yes, absolutely.
And so I also am a peer support specialist by trade. That's actually how Kenji and I met at a different UPAC program. We're both peer support specialists. And what that means is that we have lived experience navigating mental health systems. I am very comfortable talking about my mental health experience. I have a diagnosis of generalized anxiety disorder that is persistent and does not go away. But I've also, used a lot of different kinds of services, be it medication, therapy, learning coping skills, and engaging with my community that have really equipped me with being able to cope with my mental illness.
Yes.
Yeah. So I guess we could dive right into the coping skills.
Sure.
Yeah. Kenji, did you want to tell us a little bit about one of your favorite coping skills?
Oh, absolutely. Thank you, Julian. I believe for me, mindfulness is it's hard to do, it's hard to master, but once you get it and it becomes a part of your habits or coping skills, it's very much a go-to skill for me. I have, meditation and other coping skills, but in the moment when I need to calm down and I need to really focus on me and not my surroundings or kind of like perseverate on the negative. And I don't, when I want to actually just focus on the feeling and what I'm going to do about it, I really like mindfulness, and it kind of gives me a relief in the moment. A lot of times, sometimes for example, I quit smoking for a few weeks in between, I'd quit smoking for a few weeks and go back to it and then quit and go back and forth. So that negative coping skill I really wanted to work on, but all of last year in 2020, I was very, it was more of a struggle to think about dropping the negative habit. Instead, I chose to reduce it. I was mindful of how many cigarettes I smoked, and I got it down from like 5 a day plus to once a day, twice a day. and sometimes once a week, I can see the progress, and that's easier for me than just saying no more, and then something comes up, I'll hear somebody talking about COVID conspiracies, and it'll upset me, and then I'll go get a cigarette.
Yeah, that sounds about right.
Yeah.
So is mindfulness kind of like being aware, like just being aware that something is happening, like that kind of helps shift the focus of how you're processing the information, right?
Well, yeah, it's being aware, but it's also like not judging what you feel. Like if I'm frustrated and I have these thoughts, oh, this is an idiot over here saying this and that. I can have those thoughts without judgment and say, what is your action going to be? Like, what is the next step? Are you going to yell at this person? Are you going to be like, by the way, this is the actual facts? Are you, what is your choices, instead of just immediately popping off and be like, da 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 da, to somebody that probably is not going to change their thinking anyway.
Right.
Yeah.
So it's being aware of your thoughts, your thought patterns. And I think the other step, which is important is not judging the thoughts that you're having, right? That
or
is
the feelings,
or the feeling, yeah. And that is such a difficult thing to do.
Oh my gosh, I know so much.
And I think, that's the other important thing to touch on, is that the skills and these like coping strategies that we're going to talk about and that we're talking about, they take a lot of practice, and you're not going to be like, I have been in therapy for like 6 consecutive years, and I've been on and off of medication, and like, you can give me a list of coping skills, and I have been giving numerous lists of coping skills, and it's still hard, like it's still very hard, and especially hard to remember them, like when you are at a point of being like agitated or flustered or like activated or triggered or, like whatever is going on. It's very, very difficult to practice and to set kind of a routine. But the more you do it, the more it becomes like kind of like second nature.
Right.
For me, I think, and I still have a very hard time with this, but deep breathing is just like my go-to. And I've been trying to do it for so long. And I say trying because it's an ongoing process, right? That I kind of do it automatically now. And I think we all, to an extent kind of, like at the end of the day where you like come home and you're just like, like that's a deep breath that you're taking. Right. That's like your body knowing that you need to breathe.
Right. Yeah.
And so, so we can throw that in as a coping strategy. And to me, like what I've been told is like, because I wake up with anxiety, like it's just like, boom, like you're awake and you're anxious. So what numerous people have suggested to me is to try to take 3 deep breaths, like the moment that you wake up. And it is harder. It sounds super simple, but it's actually kind of hard to do.
Oh yeah.
Because by the second breath, I already forgot what I'm engaging in this practice, and my mind is like already like worrying about a million other things. So it's also important to not be judgmental of that process, right? Like not be judgmental of yourself, because it's a practice. It takes practice. So one of the important things about deep breathing is that, and breathing in general, a lot of us breathe like into our chest. And that's actually like very shallow breathing. Like you're getting oxygen in, like cool, like you're keeping yourself alive, awesome. But you're not really letting, you're not really using that breath to like release tension from your body. So what you actually want to do when you take a deep breath is try, like your belly should be rising.
Belly breath,
belly breath, rather than your chest. And it's something, it's a quick, well, while Kenji steps aside, I'll just keep talking about deep breathing. It's a very quick, easy thing to do in any sort of circumstance. I was doing deep breathing before I got on camera, like,
Yeah.
because like I said, like I'm a nervous person. So,
Yeah.
this is just like one of my favorite practices, and you can do it any time of the
Absolutely.
day. You can do it when you wake up. You can do it throughout the day. Anytime that you remember,
Do
um,
it. Yeah.
yeah, do it. No one's gonna. I mean, some people might look at you weird, if you take like
Right.
a really deep breath, but like,
Right.
it's somebody staring versus less tension in your body,
Right.
like.
I've
So,
learned to ignore like my brain, that part of my brain that says, "Ooh, somebody's looking at you," and
mhm,
and really focus on it. That's where the mindfulness comes in. You have to
yeah,
really bring that worry and change it into, okay, I'm doing something positive for myself. I don't really
mhm,
care about what other people think.
mhm,
And when you practice your belly breathing and your mindfulness, when something comes up, it's not like going to be, for me, I'll speak for myself. It's not
mhm,
like a instance of I'm just completely triggered. I'm off my rocker.
mhm.
It's going. It's kind of like, okay, this is happening now. And when I practice mindfulness, and then when something is triggered, I don't immediately go off. I have a moment to slow myself down,
Yes.
let the thought process happen, and then what am I going to do about this feeling that I have?
Yeah. That is a very important process in like regulating your emotions, because I one of the types of therapies that I took a long time ago was DBT,
Mhm.
dialectical behavioral therapy. And we were working at the time, we were working with impulse control,
Mhm.
because I was very impulsive. And
Mhm.
so what my therapist taught me is that there is this little tiny gap of time,
Mhm.
that like you can get better at like noticing. So there's this time like from where you're peaking like emotionally,
Mhm.
and when you choose to do something impulsive,
Mhm.
right? And
Oh yeah.
that tiny gap of time is like what you really want to hone in on and be
Right.
like, this is where you're like, okay, let me take a step back. Like
Right.
before I pop off on
Right.
Instagram or on this person on the bus or
Yeah.
on my boss, like
Right.
let me do any of these techniques, right? Let me
Right.
do a deep breath. Let me observe my thoughts without judgment, because you're allowed to feel however the heck you're gonna feel,
Right.
right? Like your
Exactly.
your feelings are always valid. But um it is important for us to regulate, feelings that are very, very charged, because just the way that we choose to engage with that feeling will dictate the rest of our day, the rest of our week, the
Right.
relationship that we have with the person. Like
Right.
sometimes it can affect our jobs. Like it's just, you know
I
how it
agree.
is, Kenji.
I do. I'm like, yeah, every time you're saying something, I'm like, yep.
You're like, check, yes.
Yeah, I think that, it's very important to find something that works for you, but in a
Yes.
positive way. There's a lot of negative coping skills,
Mhm,
drinking, smoking, promiscuity, and things that are like in an impulsive way. Like when I want to buy a cigarette, it's like sometimes I have to talk myself out of it and I
mhm.
don't end up buying a pack. But,
Yeah.
then there's that one time where it's just like, I can't, I won't say I can't because I can, but
Mhm,
the will to say no is not as strong.
yeah.
And so that's what I really like to want to work on. And that's what I give myself grace for, because not every time, not as much as you practice a coping skill, it's not going to work 100% of the time.
Mhm,
But you do have 100%. I feel you do have 100% control of how you react and your actions that you take. The
mhm,
feelings can come out of nowhere, but what are you
mhm,
going to do? Are you going to give into those feelings? Which, if it happens, it happens. But
mhm.
on the alternative is, are you going to give yourself a second to be non-judgmental about these feelings, think about it, and then react?
Yeah, I think that's a very important aspect of mental health,
Mhm.
right? Especially for those moments where we feel something explosive
Mhm.
happening, right?
Yeah.
And the other side of that is, um, I also sometimes I'm more of an imploder. And
Yeah.
so like while I have in the past been very impulsive to a very harmful degree, and I think that's kind of like um what you have to make sense out of is like, are these behaviors harmful to me or not?
Right.
I'm also, you know, like, while I do have a lot of anxiety, I also, you know, there's the other side of anxiety, which is that depression, right? Like those
Right.
lows, which I think is also a lot of what people have been experiencing during
Right.
the pandemic. Like on top of the frustration and like the anger and like all that stuff, there's also, you know, folks who have been very isolated,
Yes.
folks who have been very disconnected and like
Right.
and disengaged, and by folks I'm including myself in
Mhm.
that. And so it's important to try to kind of snap out of that, you
Mhm.
know. And maybe snap out of it isn't like a great way to to describe it, because in actuality what it feels more like is like a climbing out, right?
Yeah.
It's like
Yes.
little steps,
Yes.
for it. Do you have um any suggestions or any practices that you use to kind of climb out of these like depressive um moods, episodes, times that you might
I
find yourself in?
well, I feel I had my diagnosis, my mental health diagnosis is bipolar. So
Mhm.
have been on medications for years, but I wasn't diagnosed for a long time. And I dealt with, because I wasn't properly diagnosed, I dealt with depression, like in the bed, not leaving the house for
Mhm.
years. And so at that time, I can think back to when I first was diagnosed, and not diagnosed, but first experienced symptoms of
Mhm.
depression. It was awful. You know,
Yeah.
there's no, it's a numbness. It's not like a sadness for me. It was
Mhm.
just, I didn't feel anything. I didn't want to do, I hardly wanted to eat some days. I would just stay in the
Yeah.
bed. And then when I get up to eat, like a day or two later, I binge eat. And then so dealing with that in the moment was fine, because I was like, I'm happy, I'm eating, I'm sustaining myself. And then and the flip side of that is like in a month I gained like 30-40 pounds, because I was just eating and then going lay down for like 12 to 14 hours or 12 to 24 hours. And so I think for me, when I think about depression, for me, I think about the extreme of being severe, where I was in the
Mhm.
bed, I wasn't leaving the house, to where I found how to combat those feelings.
Mhm.
And it's hard, you know, it's not just
Mhm.
overnight, it's years in the making,
Yes. Yes.
You
Yes. Yes.
find
Yes.
out, you know, some days I still have days
Mhm.
where I'm in the bed for, you know, a day or
Me
two, I'm
too.
just
Yeah.
completely drained. And
Yeah.
it's I just read a quote actually that says that other people's energy doesn't affect you personally. It's the responsibility you feel to deal with that energy. So
Yes.
when I'm out in public, that's why I for years I avoided, you know, crowds as much as possible. But now, you know, I'm take public transit, I have things that I have to deal with. I try my best to be like, to avoid taking in that energy. Like I practice like visualization
Mhm.
of taking my, like if I help people and I've been out, I've been at work, I've been at outreach, I'll take that visualization and I'll pull my energy back in. So I'm
Yes.
not feeling so drained at the end of the day. Sometimes I do have days where I'm in the bed, but it's not, I know it's not going to last for weeks and months. And you know what I mean?
Yeah, because you have the coping skills now,
Yes. Yes.
right? Yeah,
Yes.
that's the big difference.
Yes.
Yeah. Yeah, thank you for sharing that.
Oh, absolutely.
The visualization, I've tried so hard to do visualization, and what's interesting is that like I am not a visual person. Like
Mhm.
I have a very hard time picturing things like images. I'm more like
Oh,
of a word person.
uh-huh.
Like when I think about something, I think about like the word.
Mhm.
When I think
That makes
Kenji,
sense.
like I've seen you often enough that I can conjure up your image. But like if
Right.
I just met somebody, like I think of them, I think of like their name, like the
Right. That's
spelling of
good.
their name. And so the way that like I kind of try to bring back that energy, because the kind of work that we do can
Mhm.
get you know, it can be very heavy,
Yes.
especially like right now. I mean, we're like in
Mhm.
the middle of reaching out to communities who
Mhm.
have been affected with COVID. And so
Right.
like, you know, you see a lot of different circumstances that can take a toll on you. And so I um I'll do my stuff through like writing, right?
Yeah, absolutely.
Yeah, and just
I
because I
love
can't,
writing.
yeah, and so
And role playing.
yeah,
Yeah.
yeah. And because that's just the way that my mind works, right? Like
Yeah.
I'll dump all of my stuff
Hmm.
onto paper when I'm overwhelmed, and it doesn't have to make any sense at all.
Right.
And it doesn't even
Right.
have to be a sentence structure. Sometimes it's just like a list,
Right.
where it's just like this person like pissed me off today.
Right.
I am not feeling well. I'm really hungry. I skipped breakfast,
Right.
that kind of stuff. And then
Right.
so that it's like out of your head, right?
Right.
And then because I carry so much, and we all do, like carry a lot of stress like in our bodies,
Right.
especially for those of us who like tend towards the anxious side, like where we're
Mhm.
like tense. I have to like re-engage my body in a
Mhm.
different way that isn't these like typical day-to-day feelings that I have of like tension in my
Right.
shoulders and like in my back and all that kind of stuff. So like for me, like engaging the senses is, it's like a really important coping mechanism. And I've been doing it like off camera. Like I have this little fidget toy that
Yeah.
I took from the office. And it's literally like
Yes.
from the dollar store,
Right.
and it's, I don't even know, like it's like mesh and there's a marble in there.
Right.
I've just been fidgeting with it. So like
Yeah.
that, engaging the senses is like a big it's really important to me, right? Like
Right.
if I've had a particularly difficult day,
Mhm.
coming home, picking up a little bit, because that just makes my mind feel a little clearer, and then like
Mhm.
lighting some incense just to be
Yes.
like, that smell is like, okay, I am in a different place now,
Right.
like
Yeah.
physically, and therefore I am not out there
Right.
experiencing whatever it is that agitated me.
Yeah.
Something as simple, I know people make fun of like essential oils all the time, but I
Oh,
love
no,
them.
no, no.
Because it snaps me out of
Right.
where I am, right? So I have like essential oils that I use before like job interviews or like speaking engagements and
Mhm.
stuff like that. Even something as simple as like this conversation that we're having, even
Right.
though it's
Yeah.
just you and I and it's being recorded, like I'm
Right.
still like anxious,
Right. I
um and so like, this is like a blend of like citrus or orange,
Mhm.
and it's just nice, it's like
Right.
for your body to be engaged in something else. And so that's like part of grounding,
Yes.
right? Which is like another coping skill,
Right.
right? And grounding can look like a whole lot of different
Right.
ways to people. I know that, like, for example, my partner will do like a very still meditation. I can't
Mhm.
stay still. Like I have to run around and like touch things
Yeah.
and do things. And that's like grounding to me, right?
Right.
So anything that engages the senses, like visually,
Right.
through smell, through, like anything tactile, like anything
Mhm.
like that, are like quick coping mechanisms
Right.
that we can use.
Exactly. I agree.
Yeah.
I agree
Um,
wholeheartedly. I love to use my aromatherapy, like taking a
yes.
shower. I'll use a certain body wash in the morning, and then at night I'll use a very calming, relaxing scent
Hmm.
at night,
Hmm.
and just giving myself a break, because I'm always, my thoughts used to, as soon as I wake up, I would start thinking this, that, and the other. What I have to do. I haven't even opened my eyes yet,
Yeah.
and I'm already planning the day. And then when I started meditating and just taking a moment and taking a breath and giving myself that space to be like, okay, this is what you want to do, but what needs to get done, if you get it done, so be it. If
Mhm.
not, then I'm not going to beat myself up about it.
Yeah.
So
You bring that up a lot, and I think it's so important to like give yourself some
mhm.
grace, right? It's
Yes,
just like we're
yes,
not gonna get it right every time.
right.
And so, we have to be patient with ourselves, we have to be patient with other people.
Mhm.
And we gotta use, we gotta explore and honestly like play around with what it
Mhm.
is that's going to work for you in terms of
Absolutely.
like
Mhm.
de-stressing, right? Because I've tried all kinds of things and I'm just like, I'm trying too hard. Like this is not working. I can't
Yes.
do the sit still and meditate. I
Mhm.
cannot do that. Like
Yeah,
I'm just, my mind will wander. And I know that's part of it, but it's like
it's difficult.
sometimes I'm
Yeah,
like, I need something now.
right.
Like I need something more engaging
Yeah,
than
yeah,
being
true.
inside my own head, which is what I'm
Right.
trying to get away from.
Yeah, don't want to linger in there too long.
No, absolutely not. Well, thank you so much, Kenji,
Of
for
course.
joining. I hope that folks find this helpful. And I also hope, Kenji, that we can do a couple more of these. I really
Absolutely.
enjoy talking about
Anytime.
mental health with you.
I agree.
Yeah,
I find it beneficial and I learn from you as well.
oh, thank you. You're so sweet. I hope that other folks find it beneficial, and that they learn something as well.
Of course. Yeah, absolutely.
Okay. All right. So we're gonna be signing off.
Bye.
Bye, everybody.